Now, the more cortisol and the more stressed you are going to deplete your dopamine. Why is that important? Because dopamine is an important neurotransmitter that allows for focus, for energy, for cognition. So if you don't have that adequate dopamine, it may be harder to focus, harder to pay attention, harder to have that good feeling, that good mood, that good connection with people because now your dopamine's low. Dopamine is a tonic inhibitor for prolactin. So if your dopamine starts dropping because you're chronically stressed, why does dopamine drop? Because it actually converts downstream to adrenaline. So the more stressed you are, you take that dopamine and you convert it downstream to adrenaline. Now your dopamine starts to drop. Your focus, your mood, your energy, your zest for life starts to drop. That's a tonic inhibitor for prolactin. So now the brake of prolactin starts coming up because you're lowering your dopamine. Dopamine is on essentially the brake pedal. Dopamine drops, brake on prolactin comes off. Now prolactin starts to go up, and prolactin can start to throw off the female cycle. Prolactin is normally made for lactation. So when a woman's pregnant, given a baby, they've given birth, they have this baby, now they're breastfeeding, you get this whole prolactin kind of letdown reflex with oxytocin. That's important for breastfeeding. But now you have women starting to make more prolactin and they're not pregnant and they're not breastfeeding. So that's a problem because now we have this hormone that comes in there, and prolactin is good because it prevents a woman from starting to cycle again. That's an important thing because you don't want to be pregnant, let's say a month or two into having a baby. That's just not going to work. So it prevents pregnancy. And then it also helps with the whole milk letdown reflex. Well, if it prevents pregnancy, what's it going to do to your cycle now? So now it can start to throw off a female cycle. Now you can have cycle irregularity, skipping cycle, longer cycles. You can have excess PMS symptoms, mood issues, energy issues, back pain, breast tenderness, cramping, the whole 9 yards. We want to really look at things holistically and say, okay, we have blood sugar. We have to make sure we stabilize it. We have to adjust our macros, our protein, fats, and carbs, not do too much so we create this hyper to hypoglycemic roller coaster. We don't want to eat inflammatory food that causes cortisol and inflammatory issues because cortisol itself can create belly fat and can create mood issues. Cortisol can also mobilize glucose. Glucose can also cause more insulin. More insulin can also create issues with dopamine because now dopamine gets depleted because now you're stressed and inflamed. It goes down to adrenaline. Lower dopamine. Now you're taking the foot off the brake of prolactin. Prolactin starts to go up, which again shuts down a woman's cycle for good reason because you normally would be breastfeeding. And it also is going to, it's good for a woman that's breastfeeding because you have that milk letdown reflex, but it's going to throw off your cycle and cause dysregulation. Now, I didn't even go into PCOS. So there's an enzyme called 1720 lyase with high levels of insulin. You can upregulate that enzyme, which drives polycystic ovarian syndrome, and that's going to also increase your androgens. Androgens are going to be problematic because as a woman, it's going to cause hair growth, it's going to cause acne, it's going to cause lots of other symptoms that are going to be unwarranted and not good. And PCOS is probably one of the top 3 causes of infertility for women today. And so if your woman wants to be fertile, you do not want ovarian cyst. Insulin is going to be the number one driver of that. That's going to drive your androgens, your testosterone up. That's why the number one treatment for PCOS is typically metformin or glucophage because they're trying to make your body more sensitive to insulin, lower that down. They'll also do like spironolactone, which is like a blood pressure medication used as an anti-androgen. They'll do that to control some of the acne. And so, or they'll even go to like vitamin A analogs. But again, you got to look at it holistically and say, hey, let's get to the root cause in this whole thing. You really want to understand that whole connection. Get your carbohydrates, get your macros, get super nutrient dense, anti-inflammatory, low toxin type of eating plan. And you want to work with a good functional medicine practitioner that can look at everything holistically, really get to the root cause of why these hormonal imbalances are there, testing it, whether it's looking at cortisol, looking at a functional glucose tolerance, looking at fasting insulin. We can even look at just your cortisol rhythm throughout the day, look at progesterone, look at estrogen detoxification. All these are great things to look at.